First of all, I would like to ask you for your permission to use this video for educational purposes.
Okay.
Excellent. Now, you and I, we had a surgery about 2 years ago now. Tell me.
18 months ago.
18 months ago. So what were your symptoms before the surgery?
Pain.
How bad was the pain?
8, 10.
Okay.
Every afternoon.
Excellent. Well, that's, you described it very well. And how far could you walk before the surgery?
Oh, I didn't.
You didn't walk much, huh?
I biked
Yeah.
a little.
Yeah, but
that
walking
even
was
hurt.
difficult.
Walking was very
Very
hard.
difficult. Now, I'm just going to swing by and show what we had before the surgery. You had a scoliosis, and this is significant. Your curve angle is about 27 degrees here, between here and here. And as well, you have an even worse curve angle up here. And what we discussed at that time is that most of your symptoms are coming from here, from L3 to S1, and even though this look worse, we said we are going to fix what's more symptomatic rather than what look worse on the picture.
Okay.
And we did the surgery, L3 to S1 OLIF, and I have the data. That surgery took us about 1.5 hours or so. And obviously every surgery needs recovery, but after the surgery, now about 18 months later, we see that this is significantly corrected, and even up here is corrected. Our thinking is that in the upper area, it was bending this way to compensate for bending this way on the lower part, and now both of them are correcting. And it seems that your symptoms are getting much better, and meaning that we don't need to go to the stage 2 and do surgery for the other region. And it seems that even though other regions are not great, bone is starting to grow, and your symptoms are overall getting better. So we are not even going to move to stage 2 of the surgery. We are just going to stay here, but we have still some symptoms. Tell me about your symptoms. They're exactly the way you described to me before.
Well, the big thing is my back is doing great, but I had the nerve, I think it was nerve endings that was doing it, and it started way up in the top of my leg.
That's the nerve root irritation that we talked about. Some people get after the surgery. So this is one of our cases, of rare cases where people have this symptom. But why don't you describe the symptoms and how are the symptoms now?
Okay, so what was happening through the time with my exercise and things, which is, by the way, very, very important, it kept moving down.
So the symptoms started in the groin and now they have moved down. How far have
They
they
have
moved
moved
down?
down, so they're below the knee.
Okay.
But now they're just kind of stuck there.
Okay.
And my leg feels like it's kind of dead.
Yeah, well, it's still L5. You said a feeling of tingling.
Tingling.
You still feel it. It's
Yep.
not completely dead, but it's tingling.
It's tingling all the time, so I know it's not dead.
Okay, so
You know.
and you still have a little bit of a weakness. We talked about that the nerves they grow back about an inch a month. So
Okay.
18 months, 18 inch. So I still think in the next 6 months or so you still may get better. Other possibilities, if you don't get better, usually after 2 years or maybe a little after more than 2 years, if the nerves ending don't find their place, your brain ignores the signal. So either it gets better or your brain ignores it and it doesn't bother people anymore. But this is obviously one of those rare cases where we have this nerve root irritation.
Okay.
So, and you're dealing with that, and with the way you are describing this feeling of numbness and tingly and so on, I think it's very typical. So that's what I wanted for my patient to understand, that how that feels if you have that nerve root irritation.
You see, what my hope is that being it's gone this far, that it'll just slowly go down, and it gets really tight across my toes at nighttime. So I'm just hoping it maybe just sneaks out and goes away.
And there's a very good chance it still will get better, and you described it perfectly. Thank you for the interview.
You're welcome.